Good afternoon, everybody, and welcome to our fourth Art of Nursing webinar, The Art of Nursing, Creative Health in the Curriculum. Today, I'd like to introduce the creative health in the curriculum. But of course, this isn't going to be a lecture on competencies or curriculum content, because we work as nurses in a much wider field. So our first speaker is a creative health in the curriculum expert in nursing. Then that's Vicky. Then we have Andy, who is a creative, an artist who's working with the universities and bringing that element of creativity as an artist into the work. And then we have Elaine, who is a creative health associate. And so the person who's working in the communities to ensure that creative health is happening. So by imagining that and yourself then as the fourth person in this kind of ways of knowing, we're bringing, so imagine four wings of a butterfly together, and the middle bit is the art of nursing. So we talk about education, lived experience, community enablement, and you and your reflection as part of this. So that's the nerdy bit. Elaine is here. Thank you, Elaine. Elaine, you're third. So without any further ado then, it's now 13:03, and I'm passing over firstly to Victoria, who's our creative health in the curriculum nurse expert for the day. Professor Ridgway, tell us more.
Hello, so I'm Vicky Ridgway, and when I first started this journey, I wouldn't have called myself an expert by any stretch of the imagination, and I'm certainly learning as I go along still now. But I thought it'd be useful just to talk you through the journey we've had at the University of Chester, where I'm a professor of nursing, and why we've put creative health into the curriculum. I've always been interested in using art-based practices in nursing education, and I've got many examples, including my PhD. And when I was the head of nursing, when we rewrote the nursing curriculum against the 2018 nursing standards, I had a knock at my door by an artist and said, "You need to read this document, and it needs to be in the nursing curriculum." And to be truthful, I had never heard of creative health until I had that knock at my office door. And actually, when I read the 2017 inquiry report and the recommendations that healthcare professionals needed modules and evidence base on the arts and health and well-being, it really sprung to me the importance of actually non-therapeutic interventions and how, as a nursing workforce, we needed to be able to do that. So I took the opportunity then to actually put in a curriculum aim into our programme to make sure that this was truly embedded as a programme philosophy, but also it threaded it through our learning and teaching philosophy. And as part of that, we decided that we would develop an immersive clinical experience linked to creative health. And that's how our creative health placement formed. We started this in 2022 with just 60 nursing students, and now all of our Bachelor of Nursing students and our Masters in Nursing students undertake a creative health experience in the first part of their programme. So we're talking about 450 to 500 students a year that participate in that experience. When we started this, and there was no other published work on it. No one. I talked about sort of a toolkit to develop. So I'm very happy to take questions about how we did it. But basically, we worked with the Philip Barker Centre for Creative Learning, which is a centre at the university, and they helped me explore which artists we could work with and how we could formulate the placement. And then as a nurse, I understood sort of our governance structures and what we needed to put in to make it a viable simulated placement, as that's how it's came. We worked with the artists about a year before we ran the placements to understand our own philosophy and their philosophies, and worked about how the placement could be formed. We also started preparing and looking at social prescribing offers out there in the community, so that it wasn't just an immersive experience for our student nurses. They could actually see it in action as well on the placement. So we have come quite a way since 2022 on our placement, and I'll just talk about how it works now and some of the feedback we have. So the original placement, the students worked with music, dance, and 2 art-based offers. Some of the feedback we had initially was that they found some of the aspects of music quite challenging, and they found that dance particularly challenging with the use of touch. So we listened to the students and we refined it, and the length of the placement was 6 weeks, and they said it was too long. So we now run a 4-week placement for all our student nurses, and they work predominantly with 2 types of art forms, art and music, so that they have a key theme through that. And then they have taster sessions from a range of other creative health professionals, including dance, theatre groups, so that to give them an idea of the scope and range. And because we have all 4 fields of nursing at the University of Chester, we try and theme the placement according to the group of students we've got. So we look at mother and babies, artists that work with people with enduring mental health conditions, etc., just to give it that flavour and relevance to their field of practice. They have a formalised spoke day that they go out and visit, so they can see from their immersive experience, a real life experience. And then they have personal time for reflection and writing. And one of the things we discovered when we started doing the journey was that this was very different for what people would conceptualize a nurse would do. And that's been some of the challenges we've had initially, is that they thought that when they were student nurses, they would do a blood pressure. And actually our practice assessment documents on the competencies and proficiencies that student nurses have to achieve are very, very dominated on the doing of nursing skills. So if you look at Annex B, it's from bed making to chest oscillation, and it's very difficult then to articulate to a student that that's actually something that you need to do as well. But Annex A is all about person-centeredness and communication skills. And this is what our students have started to say they've learned and valued, is that they can see the benefit from it. So the students talked about having to jump in feet first, that they actually found it quite terrifying. It's nothing that they expected, but they talked about the time spent on social prescribing and within the creative health immersive experience, that it enabled for them to see the benefits of that experience. And I want to just read a student reflection for you. Overall, the experience of creative health has been eye-opening and has changed the way I will deliver healthcare. I've expanded my skills and knowledge on social prescribing and also my communication skills. I'll definitely be suggesting some of the preventative methods to patients in the future. So this is something that's really important to us, because it's opened their eyes to something quite different in how they'll be able to use it. And I've just seen actually as popping up, one of our students that's currently undertaking the placement has just joined this chat. So I'm hoping that they'll, be able to perhaps put things in the chat about their experience. As we took evaluation, and we've had a research study which we've published recently in Nurse Education Today, if you're interested to read more details, the students started talking about how it improved their own well-being as well. And that's something that's key to for nurses as well, because our standards for education talk about us being resilient and being able to look after ourselves. So the fact that students have participated in an immersive experience to learn about alternative therapies and modes of delivery of care, but it's also actually helped them improve it. So we're actually at the moment, we are going to measure using the Warwick Edinburgh scale, wellbeing scale, pre and post placement, to see actually how much impact the participating placement has it. And we've got some initial data that actually starts to show that. We also, because it was new and the people we used to assess the placement, so those practice assessors and practice supervisors, it was quite new for them. So we took some feedback from them. And one practice assessor said recently, all the students spoke very highly about the placement and seemed to have gained a lot professionally and personally. Most referred to it as an eye-opener. And they talked about it was really important that students had this understanding alternative creative health therapies, and that they were a really big advocate for it. And it was how great they thought that this was a student placement. So we've taken feedback from practice assessors and seen it. We also invite members of the public in to the service in the pilot, and we took a set of feedback from and that they felt much better than before. And that's key to the experience, really, that the students can experience it from an immersive experience, but also work with service users on it. I think the most important thing that we've learned is that it's a journey. And I can take some questions on about how we've implemented it into the programme. But the key things the students have cited that they've learned is improved communication skills, improved empathy, and better listening skills, how that you can use art as a form of expression and communication, the actual impact of creative health on service users and how important it is in modern day healthcare, that it shows a holistic, person-centered approach to nursing, that it's actually beneficial to health and well-being, that it's important for their own self-care, that it's improved their ability to teamwork, and that they wouldn't change it, even though they didn't perhaps like it at the beginning or thought it was very different to what they expected, that it was an experience that was really beneficial for them. We are very proud of our journey at Chester. We actually won the Student Nursing Times Community Placement of the Year in 23 for this placement, which gave us the impetus to push forward, because we felt we were quite brave actually doing something very different. And I have talked to a lot of other education providers over the last few years about how important it is for us to immerse ourselves in this experience and give our students a different view. And I think I've probably talked for getting on for just over 12 minutes, so I will stop because other people need to speak there, but I'll be happy to take questions at the end. Thank you.
Thank you, Vicky, and we will have time for questions at the end. And it is really heartening to hear this. I trained as a nurse in the 1980s, and then public health specialist, and have always used the arts as a type of health promotion, also therapy, and then in education. And I think building up the evidence base in nursing now to ensure that we marry up the uniqueness of what is nurse ways of knowing in this, alongside the medical humanities. I've just received a poem from a nurse in Korea who's specialising in AI, and her way of managing the work of AI with nursing is to write a poem about it. And she says the people in nursing say, oh, this AI, it's too technical, all of this coding. And the people in AI say, oh, it's too philosophical, this is too soft. And in the middle is nursing. And the way that you can explain that way is through her amazing poems. So that would be one of the other elements. So Claire can't be with us, it's 10 o'clock in Korea and she's got 2 kids. But this way of being part of nursing and part of the future of how we act as nurses and how we educate as nurses is global. This is a global movement now. So thank you, Vicky, and there'll be more questions, time for questions at the end. I want to move us now to Andy, because Vicky stressed the issues of communication and eye-opening, and Andy's work is I couldn't use a better phrase than eye-opening with your work. So Andy, I'm not going to say who you are. Please say who you are, and you've got 15 minutes to open our eyes.
Hello everybody, yes, I'm Andy Farr. I started out in a very different life, but for the last 15 years or so I've been an artist and increasingly an educator, and I'm started my PhD at Nottingham University last year. What I want to talk a little bit about is the role of art in understanding, really. I mean, I started out doing a project back in 2018, 2019 with the Institute of Mental Health, where I was working with people who had experienced trauma. And the focus of that was around the objective was to help other people to understand what trauma felt like, the lived experience of trauma, hopefully to generate a level of empathy, and then give people a sense of hope that actually it is possible to grow and recover from those experiences. And I say I did the first project in 2018. I did 4 more projects since then. I've worked with about 50 people. And what I do is it's not what people would think of as art therapy. I have a dialogue with the person. I create a painting, and then we have an interaction around that, and then it gets shown to the, exhibited in an exhibition, shown to the public. And so I sort of have 2 audiences. One is the audience, as in the person I'm working with, and the second is the wider public when that work gets exhibited. And then what I've been doing more recently is using the artwork and the testimony from the people I've worked with in training of mental health nurses. So I did that work with Nottingham Trent University, and we were shortlisted for a Student Nursing Autonomous Award a couple of years back. And what we were doing was taking cohorts of nurses, and then Nottingham Trent has got an immersive video room, so you can show video that goes on the 2 side walls and then the front wall, and we take cohorts of nurses in there, and we use the video and myself to kind of give people insights into what it's actually like to experience trauma. And the feedback from, I'm just going to read one bit of feedback, which is this sort of environment, as opposed to a clinical ward, is more natural and conducive to explore trauma. On a ward, you may not be able to see to get this sort of insight. It's a different kind of space for reflection and understanding, and the feedback was really positive. And that kind of comes back to thinking about what is the purpose of art. And I think there's a danger that people think you have to be some kind of expert in art to understand it. And there's a great book I've been reading recently by Alan de Botton and John Armstrong. And one of the things they say is art is not just about aesthetics or historical significance, but serves an essential psychological function, such as offering comfort, providing perspectives, and encouraging self-understanding. So, yeah, basically what they're saying is, art can actually be quite a powerful catalyst for helping people to understand themselves and communicating. So if we go to the first painting, which may be, okay, can we go to the second painting? We might go back to that one in a second. Yeah, so this painting was done back in 2018, and as you probably guessed, it's of a paramedic. And this is a guy called Adam, who I worked with back then. And when I first started talking to Adam, he was worried about actually being in the painting, but he was explained to me very carefully what it's like as a paramedic to go to an accident and the experience you have when you sort of go into almost like a trance-like state of having to deal with the events at the time and not really being able to process what's happening. And at that time, the uniform is quite important because it's sort of like a shield and people understand what your role is. But afterwards, he says you don't really get a chance to process the experience. And because you have this perspective of being a hero, and that obviously translates into nursing and into the police and firefighting and all sorts of professions, where because of the uniform, you're almost, as you feel you shouldn't be seeking help, and you should be brave and you should be strong, but actually the reality is that everyone experiences trauma, and you need to be able to have time to process that. So what we were trying to do with the painting was show that inside the uniform there's a person inside who is vulnerable and suffers pain. And so, as I was saying, the conversation with Adam was around whether he wanted to be in the painting, and it took quite a while for him to decide he did, but once he was then very active in using the painting within the paramedic service to encourage other people to actually take part in things like peer support and to discuss what's going on. So that painting was quite important to me, and that was more of a painting that communicated outwards. If we go back to the first painting, this is of a woman called Rachel, and her trauma related to a birth trauma. She had a very difficult birth where she was actually partially awake during she had a cesarean, she was partially awake during it, but obviously people weren't aware of that. And afterwards, she struggled to reconnect with her old self. And so what the painting was portraying was the kind of dark, gloomy version of Rachel, which is how she felt after the birth, trying to reconnect to this original, more vibrant, colourful, active person. And what she said, she was also having therapy during this time, but what she said at the end was, I went to bed thinking about the painting, and it's almost like now there is a third Rachel, the one I am now, who is able to connect with both figures in the painting. So it's not that she went back to how she was before, or that she stayed as a kind of monochrome grey version of herself, but she's actually now a new person who was able to move on and integrate those two aspects into herself. And that's really the kind of processes of trauma recovery. The first stage is about feeling safe and safe enough to be able to share your experiences. And I think art and art therapy and forms of visual communication are actually potentially quite useful there, in the sense that the most important thing at the start of someone talking about trauma is that they're not in a state of fear or arousal. They need to be in a calm, relaxed, co-regulated environment. And if they are, then they can start to process and talk about what's happened to them. The second stage is often a sense of mourning, almost a loss, what you've lost. And then the third stage is around this reconnection and reintegration of yourself. And that's really where we see Rachel. So as I say, we've been using stories like Rachel's and Adam's in, I also do a session with the MA Trauma Studies students, and I do a session with the mental health nurses. And then obviously I work with the wider public, trying to use the art to give people an understanding of lived experience, and help them to process what's going on. And so obviously I got a really positive response from some of the participants. And one of the people I worked with is a wonderful woman called Marissa Lambert, who now runs a peer support network, but she started life as a psychiatric nurse. And she said those that donated their stories felt understood, as if by translating their words into colour, their suffering diminished. Sharing alleviates pain and distress. And I think, what this work does is it gives people a different way of talking about their experience. So I'm conscious I'm probably getting towards the end of my allocation. So I'm going to talk about four things. One, the work which you're seeing is currently part of a virtual exhibition run by a wonderful organisation called ArtCan. So if anybody wants to see that virtual exhibition, if they go to artcan.org, there's a link to the virtual gallery. There's also a link off my website, andyfarr.com. And then the second thing, and if you want to see the work physically, it's going to be in Coventry Cathedral in October and in Lewisham in November. And then the other thing is, as I say, I'm doing a PhD at Nottingham University. My supervisors are in education and philosophy, which is a bit of a weird combination. And I'm not quite sure where I really fit into this. I know what I'm doing is quite interesting, but quite where I fit, I'm not sure. But one of the things we did for the launch of the last exhibition, and it was a really powerful event, but about 6 of the participants gave their own personal testimonies about their experience of trauma and how they recovered, some of them using somatic therapy, some of them using EMDR, various techniques. All of that event and the paintings and the narratives are on the Nottingham University website. So again, we can share that link later on, but if you Google Andy Farr being seen Nottingham University, it pops up. So I think I'll stop there, if that makes sense.
Can you, Andy or Vicky, put your thumbs up if you can hear me? Oh, that's good. So thank you, Andy. As I say, that the images are so visceral there, and we know when we work in the arts and health that the artists of old have the right language and the right views as well. And art is not what we see or do, it's what we enable others to see and do as well. So when we speak of the person's third image, then beyond this reality, that really speaks to the impact that me as a nurse has seen in this, but also as an academic can prove, and as an educator, bleating on about constantly. So I noticed somebody said they weren't expecting to cry with this. We do tap into emotions. That's what this does, and that's why nurses can embrace the creative arts and are doing it already. It's not necessarily you need to have got an A-level in art or an MSc in creative art or even any of this. It's part of our ways of knowing already. It's just maybe not what we've seen. And we talk of AI and digital literacy, and everyone doesn't balk at that. They go, oh, that's important. You know, we didn't have it before, but now we do. And we need to just recognise that the AI element of arts intelligence as well, and the artful literacy that we need to build in concert with the non-human elements. And with that in mind then, I'm going to introduce you to Elaine, and Elaine is going to, oh wow, the work, if you haven't cried already, also, this is the work of people who are connecting with the community and using arts, and as a nurse, when I see this, it just speaks to my heart as well. So Elaine, tell us all about your work, please.
Oh, thank you so much. Are you able to share my
Yes.
PowerPoint? And I'm very sorry, but as a creative agitator, I felt I had to break the rules and share a presentation. The work's very visual, so yeah, thank you very much for letting me share this PowerPoint. And yeah, really impressed with the two presenters so far. It was just great to hear about your work, and sort of moving on from what Andy said, there's a real movement in the art world that's being sort of led by this group called the Association of Arte Utile, and that's the use of art. So shifting from that sort of psychological comfort that you might get from art, this is kind of going, what's the use of it and how is it going to transform people's lives? So I think this is sort of where my work sits, and I'm going to speak about a women's mental health huddle that I started as part of my role. It was launched in Liverpool Babies Week in November 2023 in partnership with the Improving Me Cheshire and Merseyside Women's Health and Maternity Team and the University of Liverpool's Emmerich. And then, of course, it was the National Centre for Creative Health and my role as the Creative Health Associate that funded this work. So it came out of a need to address the gender health gap. There, as we know, there's a lack of research into women's bodies, so we're often diagnosed with mental health issues when what we're actually experiencing is hormonal issues or unexplained physical pain. And the recent research commissioned by CALM shows that young women are, believe it or not, likely to be told by medical professionals that they're exaggerating, they're being drama queens, or even asked if they're on their period when they report mental health issues. So this is almost out of this anger. This is how System Apps project began. So can we go to the next slide, please? So we would run the huddle collaboratively collaboratively. We offered a safe space for people to share lived experiences, and we used creativity to co-produce solutions and try and resolve some of the challenges that we face in healthcare. So we used a creative approach to the recruitment. This is an installation of a teddy bear's picnic labyrinth in the children's library as part of Baby Week. And the labyrinth is an ancient archetype that's found in many cultures and art forms around the world. And it's intended to be a calm, introspective space for contemplation. And I've found it really useful to use as an installation to share maybe some quite sensitive health topics. So previously I've worked with people with dementia with labyrinths. So we also had an artist that offered participatory workshops, and this invited mothers to share their lived experience in a very gentle way and helped us to engage potential participants for our mental health huddle. So posters were also shared, and obviously emails went out, but most of the women who attended actually found out about it on the day. So as the huddle evolved, we had a core group of 6 women. The frequency, days, times of the huddles were agreed collectively, and we decided to meet fortnightly. And after a few sessions where we compassionately listened to people's lived experiences about their mental health recovery, we noted down the services and support that people referred to. And this was then developed with some additional mapping into what we called a systems map of mental health services and support. It included NHS, voluntary sector, local authority, workplace support and digital support. So next slide, please. So this systems map was produced using a website called Kumu. And by grouping the services and support according to sector, we created what actually turned out to be quite an attractive looking systems map. This was then printed onto fabric, and we invited our group members to embroider their recovery journeys. And what we noticed as a group, we shifted from just sitting around a table and talking to people just having a real pride in what they were producing. And also the atmosphere in the group changed, and everybody suddenly wanted to come every week instead of fortnightly. So we also shared the textile map when we learned more about people's lived experiences, and one of our placement students actually began to embroider her own journey, her own experience of CAMS and other NHS services as a teenager, and it helped to build the confidence to share her experience within the group. We also shared this map in a local bar as part of an exhibition, and we found that men surprisingly got involved, and they really welcomed the opportunity to speak of their own mental health and well-being. Next slide, please. So this is a list of our partners. Moving on to the next slide, please. So yeah, we worked, as I said before, with EMRIC, which is the Mental Health Research Innovation Centre. That's a partnership between Merseycare, NHS and the University of Liverpool. Also Improving Me, Cheshire and Merseyside's Women Health and Maternity team. Liverpool John Moores were involved as they provided placement students, and then Liverpool Central Library were amazing at providing space and promoting the work we were doing. We also led workshops at Liverpool University Hospital Foundation Trust as part of a dementia conference. And it was great to see staff and patients engaging with the system app, and also having these realizations about their own recovery journeys and what worked for them. Transforming Choice Recovery Group we worked with, and we also worked with Make It Happen, a mental health recovery group. The exhibition, if we can go to the next slide, presents a range of the system maps that explore our community's lived experiences of mental health and wellbeing services. And the aim was to reach service providers and instigate change, help them get an understanding. As you can see from that central system map there, there's a lot of toing and froing, not surprisingly, between services. And we hope that this might be an opportunity for people to join the dots, as we were doing here, literally, but actually, you know, maybe connect and understand how the patient's journey is, and if we can improve it in any way. So our ambition now is to increase the number of workshops that we do, scale it up, and allow individuals to promote the existence of their services, and learn about how many connectors we make with these services. We hope it'll encourage the idea of, like we said, improve the experience for our communities. So this creative health project is a great way of understanding a patient's journey. And as I said before, the patients reflect. But when I saw the title of this webinar, I felt obliged to share a project that I've developed in a previous life when I was at Liverpool John Moores University. So if I could just move to the next slide, please. I just wanted to share with you the Arts Loco project. So this is a Nursing Times article that describes the project. It was designed in partnership with the School of Art, School of Nursing and the School of Psychology within Liverpool John Moores University. And we also partnered with what was then Aintree University Hospital's art programme. So I had a couple of students on placement within the hospital, and I decided to embed myself there one day a week to get a better understanding of their experience. I was also about to embark on my PhD, and I was keen to explore avenues for my arts and health research focus. So during that time, I was hugely inspired by the benefits that the arts activities had on patients. And we discovered the King and Queen of Tango. Who knew that they existed in Liverpool? Whilst a dance practitioner was on a ward, a male patient declared that him and his wife were champions of tango. And they asked if the dancer would dance with his wife as he recovered from his hip operation. I also witnessed a young woman who had been in a horrendous accident, and she was unable to move from the neck down. She was clearly depressed, refusing to eat, until artists were placed at her bedside. And she had a creative experience where she was able to hold a paintbrush and directed the artist's movement. So she was able to produce a canvas painting herself. And this actually helped her overcome a psychological barrier to healing. And shortly afterwards, she was transferred to a less dependent ward. So without doubt, the arts had a huge impact on patients, and it supported patients' healing journeys. But there was little to no funding to scale up these art experiences. But meanwhile, back at the university, I was constantly being asked by art students about placements in art therapy. So I joined the two dots and came up with the Arts Loco project. So I partnered with a nursing academic and the hospital arts manager, and we co-created what was almost a placement programme. So I didn't want to helicopter a bunch of students into an environment that they had little or no understanding of. So, and more importantly, we had to be careful of the patient's needs and patient safety. So we offered training almost in safeguarding, infection control, in what was good practice in hospital arts. And we also shared some inspirational examples. So the students were placed into multidisciplinary teams. So like I said, we had the nursing students, psychology students, and the art students. And they then, in the final week, would present in a Dragon's Den style their ward-based activity ideas, and then they would go on and deliver them. So next slide, please. This is just an example from the article of the type of activities. We had painting on the wards, which was quite a simple activity using stencils. Vinyl images was a really fun music, almost flash mob of a sort of 60s music would just descend upon a ward and just completely brighten the environment. And actually that was led by a student nurse who then, when he was newly qualified, would introduce and bring music onto the wards himself. The project was acknowledged by Health Education England, and I've given some examples there, which I'll also put in the chat of the publications. So Health Education England recognised it was supporting and empowering learners, and it was developing and implementing curricula and assessments. It was also highly commended by Building Better Healthcare Awards in 2017. And also my relationship with the Hospital Arts Programme extended to me supporting their fundraising. So I managed to get some Arts Council funding to put professional artists on the wards that our students would work alongside. So it's amazing to hear the work that Vicky's doing. And I think it's really important that all nursing students get the opportunity to engage in creative health, because it doesn't just enhance the well-being of patients, but it also enhances staff's well-being. And of course, meanwhile, our students are getting fantastic work experience in what turned out to be their future careers.
Our next webinar is in May. Look out for that. We'll be focusing on our work with people who are seeking asylum, people who are less heard and seen in the system, and how nurses are using the arts, more PhDs, more practical work to actually work in partnership with those who we find most challenging to be in partnership with. After that, we're going to have nurse authors, nurses who are writing books using their experiences, fiction, and engaging with that. And we'll have the exhibition at the RCN in the summer as well. Thank you all.